Great. Thanks so much, Emily. And really thanks everyone for joining us today for this webinar on care reform in the context of the Poli crisis. Um, so first of all, just to share some of the logistics. So we are recording the webinar, as Emily just mentioned, and we kindly ask you to please put yourselves on mute and then to introduce yourselves in the chat box. So please, if you could insert your name, your country, and who you are working for, that would be greatly appreciated. And another very important point is that we have interpretation today. So you will see at the bottom of your screen a globe, and if you hover over that icon at the bottom of your screen, you can choose your language and then mute the original audio. So even if you don't require interpretation, we would encourage you to select the English language channel. So if you have any issues, any questions on that, please feel free to enter those in the chat box. And before we move ahead with the topic of the webinar today, I wanted to provide a bit of a background on the learning platform and also a brief update on the upcoming activities. So as some of you may know, this regional learning platform was set up by UNICEF Asaro with contributions from Changing the Way We Care. And it provides really a critical opportunity for policymakers and practitioners across the Eastern and Southern Africa region and beyond to exchange on learning on care reform. And so kind of our regular outputs are newsletters, webinars, we produce policy papers, videos, and case studies. And we also, and this is very important, we have a help desk which allows anyone in the region from government or from UNICEF to request support on care reform. So that's a very practical support that we provide. You will also then find in the chat box some links, including the platform webpage, the YouTube channel, and also a link to a short form through which you can join the mailing list of the platform. And really joining that mailing list is really critical because that's the most immediate way that you can find our resources, you can find out about future webinars and any upcoming events that are planned. And each month we send out a newsletter with a short 5-minute article that can give you some insights into different aspects of care reform. So really an important resource. And we also importantly update on any kind of progress in relation to care reform in the region, but also globally. And so we are now with the platform already in our 4th year. And so you will also find in the chat box a link to the rolling work plan so that you can really see what is planned for this year. You will see, among other things, that we are planning practical workshops on aspects of care reform. We are planning to limit the attendees at that workshop in order to enable more of an interactive learning experience. And the first workshop will specifically look at tools developed by UNICEF's data and analytics section on enumerating children in residential care or assessing the quality of this care. So that's going to be the first focus. This will take place in May, and we will share details on how to sign up to the webinar via our mailing list in the coming weeks. So please do look out for that opportunity. We will give precedence to UNICEF and government staff, but if spaces are available, then others are most welcome to join this opportunity. And we really encourage all UNICEF staff on the call today to share this opportunity with their government counterparts. During this 4th phase of the platform, it's really pivotal that we decide if the platform should continue and what form it should take. So a key aspect of this decision is finding out from you how valuable you think the platform is and how much time you can put into the platform. So we ask you to spend a couple minutes now completing a short and anonymous poll. You'll be seeing it up on your screen. So that you can help inform the next steps forward, we're going to take about 3 minutes to complete this poll. So then we will start the 3 minutes now. Thank you so much for participating in this.
Kongi had said
Okay, I think we can
Yes.
continue. Yes, thank you.
Great. Thanks, Emily. And really thanks for everyone for taking those few minutes to share your feedback with us. That's really critical for the way forward. So then let's turn to the topic of today's webinar, and most importantly to the speakers. So we are focusing on care reform in the context of the Holy Crisis. So what do we actually mean by this? So when we refer to the Holy Crisis, we're referring really to the combined impacts of COVID-19, climate change, and conflict. And we know that although levels of COVID have thankfully diminished, the pandemic has had really a lasting impact on care in the region. And then further, climate change and an often related rise in conflict are having a huge ongoing impact that is predicted to worsen in the years ahead. So that's really very concerning. So we will today, in our webinar today, explore really each aspect of the Holy Crisis in turn. We're first going to look at the legacy of COVID-19 on care reform in Uganda. Then we will be looking at a recent case study developed for this platform on the impact of climate change related drought on care in Kenya. And then finally, we are going to look at care in the context of conflict in Ethiopia. And then finally, we're going to wrap up at the end with some conclusions on how to carry out care reform in the context of this Holy Crisis. In terms of just some housekeeping points, we will be taking questions at the end, but we really encourage you to, as questions occur to you, to just leave them in the chat box. That will be very helpful to us as we then prep for the discussion in the end. And don't worry, all slides will be shared on Google Drive. So you will be able to access all those without any issues. So then with that, I'm really pleased to introduce our first speakers, David Adoke, the Country Director of Child's Eye Foundation, and Susan Alamai, the Senior Probation and Social Welfare Officer working in Tororo District in Uganda. And they will be sharing us some reflections on the lasting legacy of COVID-19 on care reform in Uganda. So with this, I turn it over to David and Susan. Over to you. Thank you.
Thank you,
Nicola, for the introduction. I will be taking the first part, talking about the lasting legacy of COVID-19 and care reform in Uganda. And Susan Alamai will come in with the government piece, talking about how it affected service provision. So my name is David. I work with Child's Eye Foundation, an organization focusing on care reform in Uganda and pushing to ensure that children thrive and grow in safe and loving families. Next slide, please. Thank you. So during COVID, March 2020, we had a lockdown where the president announced an ordinance closing schools. And this was a period that was very scary. And we saw that many of our institutions, also called residential care facilities, and mostly the ones that were registered as schools, returned their children back from the schools to the families. So what did that mean? There was actually a rapid return of children to their families without adequate preparation. We had just a time frame to do this, which was not enough for many of them. So we all know that in terms of preparation for children who have been in an institutional setting, there has to be adequate preparation for them to go back to their families. And it requires extensive preparation. It requires monitoring and support over months and sometimes going to over years. So with this lockdown and what happened, the presidential ordinance, there wasn't any preparation that was done. And we saw that this could actually recreate serious risks and cause long-lasting harm to children and families. Next slide, please. So what did we see during this period? We also saw that this reunification, this rapid reunification also decreased donor funding to some of the institutions. Some were our partners and some we heard about this. Some institutions as well received donor cuts. They did not have funding to pay for the food and other basic needs for families. And we saw that they actually had financial constraints. Parents had to accept children who didn't return to institutions after lockdown. They were used to having children only for certain periods of time during the holidays, but this time they had them for quite a long period of time. And we saw that institutions also tried to keep a small number of children within their care due to the financial constraints that were happening during this time. Many of them also lacked support due to complete stoppage of funding from donors abroad, from some of the supporters who used to visit the institutions and actually give them some food. So we saw that there was this massive shift where everyone was actually locked down in homes, and institutions had no access to some of the services and some of the support that the community and some of their donors were offering. Next slide, please. Now, what we have here is just a representation of some of what happened during lockdown and some of the institutions within the different districts. We saw in Toro district, in one institution, 17 out of 19 children were rapidly returned to families by March 2020. And out of these 17 children, there were 2 who were aged 17 and a young adult stayed due to unknown family. This was an institution that actually had about 23 children within their care. 10 of the 17 who returned families were placed with biological families, and 7 with extended family. I think we can actually see out of these statistics that children actually have family out there. They have their biological, they have their extended family out there. In MPG district, one institution rapidly reunified 49 children out of the 56 that they were supporting, and 7 remained in the institution due to unknown family. And with that, the tracing continued. Kampala district was also a bit unique. There's an institution we're working with in Kampala district under the Catholic Church. And during the lockdown period, 2020 to 2021, we worked with them to place 11 young people in supported independent living due to their desire to leave the institution. What was unique about this piece was that during the lockdown, the young people within this home actually realized they did not have freedom to move out of the home, and they were restricted. They actually now opted to be placed in independent living. We had been engaging the institution as well as the Catholic Church to transition their services into a community hub. Many of the young people saw this as an opportunity to actually start a new life outside the institution. So with the various restrictions, what we did is we worked with community volunteers, we worked with the youth officers, we worked with, after getting passes and the ability to have one person moving in the vehicle with the driver, we were able to actually support these young people transition into supported independent living. Many of them were able to get accommodation just outside where the institution and the surrounding areas was. This was something that was absolutely very, we saw that the young people yearn to have that community presence. They yearn to have people to interact with. They yearn to interact with other young people within the community whom they had been interacting with. Next slide, please. So what did this mean for us in terms of the lockdown and affecting the work that we're doing? We had to adapt to be able to support the families within Kampala and the regions we're working with. We moved into a hybrid system, and we have a network. At that time, we had a network of over 600 community volunteers, and these were used as the frontline response case managers for this kind of crisis. The picture here is just a depiction of some of the support and the work that we did during the lockdown. We were able to provide some bicycles, some protective equipment, masks, some sanitizers to the community volunteers to ease their transport and moving around during this period. We were able to get permission for community movement to be able to support the most at-risk children and families. And one thing that we realized is that we had to support children rapidly, so the community volunteers whom we had trained in child protection, in case management, in alternative care, were the ones who actually at the front line to be able to support the families. We made sure that we created networks with suppliers who would actually provide food, who would actually provide some medical care for families so that this help would actually go on. This period, I would say, was a real test for the structures and the systems that were created in the communities to see whether these systems would actually work. Next slide. As mentioned before, we moved into a hybrid system with a network of over 600 community volunteers. This is also a photo of some of the support that we gave the community volunteers. You can see them with some PPE pushing bicycles, and this was during the period when a lockdown had actually eased, so that the community volunteers were able to access families. They were able to be in contact with some of the suppliers through our procurement systems to be able to support the families. We used also to actually send some financial support directly to the families as well. But we ensured that each family was attached to a community volunteer to receive ongoing support. Community volunteers were also able to provide support in terms of assessment and referral to health centers, referral to other government agencies, wherever the support was needed. Next slide. Now, I just want to share about a little bit about the impact on families, the impact of this on families. We can see that there was a general concern during the lockdown. Many families were unable to continue some of their economic activities. So there was the cost of living increased, most especially within our urban centers. And we saw that there was a big desire for most of the families in the urban centers to return to the rural areas where there was some land, so they would be able to till their land and actually live off the land. We saw that households struggled with travel and work restrictions. Many of the family members had to walk long distances because transport was restricted to go and work. Alongside the worries about basic services, malnutrition became a really big issue where breadwinners lost income. They could not be able to provide for their families because we know that mostly in the urban areas, it's basically hand to mouth. What you're going to earn in a day is what you're going to spend on feeding your family. Food and fuel expenses shot up 5 times the usual costs. And we saw that caregivers as well faced potential homelessness. There was a period where they could not work. Rent was also increasing. We had some evictions of some of the families that we were supporting, many financial hardships, and as well as also the reluctance of the families to accept children from institutions due to the rising costs and the medical needs as well. Access to medical services was also something that was difficult, most especially for those with non-COVID related medical needs. We saw a rise in an increase in domestic and child abuse, domestic violence and child abuse during this period. There was a lot of sexual abuse, and we can see some statistics here, which were shared that 354,736 teenage pregnancies were registered in 2020. That was after the first lockdown, and 196,499 in the first 6 months of 2021. So this is according to UNFPA, and this is what we have that is recorded. So what about all teenage pregnancies that went unrecorded? This just shows us the gravity of the situation during that period. Families, which we see as the basic unit, of the community and supposed to be safe, became environments where children were highly vulnerable to abuse and violence. Next slide. So really quickly, going through this as well, we saw that children were disconnected from their positive relationships from school that they relied on, as well as some community networks. We had a lot of suicidal ideations and an increase in depression for many of the young people who are now really worried about their future, most especially those in the teenage. We saw that we lost some caregivers, some family members, as well as also our frontline community volunteers. We saw the restrictions. People could not participate in communal activities such as funerals, to go through grief counseling as well. Online classes was something that the education system adapted to, but how effective was it for those who actually could not afford data, who did not have any gadgets to go through the online classes? So this was a period that really tested some of the systems that we really rely on and the way that we live our lives. Some of the mitigation measures, I've spoken about them, but just to remind us all, for every For every rapid reunification, we provided some case management support after the lockdown was eased. We had an emergency fund that was provided to the staff who are in contact with the community volunteers and the families for any emergency support. We continued our economic strengthening programs to support families through the contact with the government agencies as well as the community volunteers. We continued having meetings, online meetings, through phone calls, through Zoom with our community volunteers and the parasocial workers who had access to phones. We directly contacted our networks within the hospitals to alert them of any referrals that were coming their way. I talked about PPE, personal protective equipment, that was provided to community volunteers as they supported this work in the community, as well as also provision of mobile phones to some community volunteers to be able to ease the communication. And one thing that we saw is that community volunteers who were able to visit 2 to 5 families a week increased and were able to support up to about 10 families in a week. So that increased their efficiency and their support within the communities they work in. Next slide. I've talked about the bicycles to the community volunteers. We increased the number of children and families they could visit within a day, as well as also our team scheduling calls with families to ensure that they check on them through this period. I'll just touch a bit as well on challenges post-lockdown, what happened after lockdown as we eased into opening up. We know that institutions are still actively recruiting children from families that struggled financially during this period, because we know that many families lost their livelihoods during this period. So this is one challenge, as well as looking at also when schools opened. Many of the young people actually who had this break during the lockdown were engaged in some economic activities, and so were not regularly attending classes as they used to, because they had lost a bit of interest in school. And once they started earning a little bit of money, they felt there was no need to actually go back to schools. We've had to grapple with the issues of catching up on almost 2 years of education being lost, and many young people dropping out of school, most especially the girl child who suffered from a lot of defilement during this period and the teenage pregnancies. Next slide. So as I wrap up, these are some of the lessons that we learned during this period. This period, COVID-19 really highlighted the importance of the social service workforce as recognized by the government. We collaborated with our National Association of Social Workers to sensitize communities, sensitize government, sensitize our other stakeholders on the importance of community, as well as also the importance of keeping ourselves safe on how to survive during the period of COVID-19. The integration of our social service workforce is really essential during emergencies, both at the micro and the macro level, and is very crucial for strengthening our systems and preventing separation of children from their families. Our community volunteers are our unsung heroes and a really vital component of the community-based approach of social work, and contributes to strengthening our systems. We found that individualism is really inadequate in terms of some of the contexts that we're working with during this period, and we emphasize the effectiveness of community-based approaches during periods such as this, where the community can come together and actually provide support to one another. Next slide. So just to say thank you for listening to me and my presentation. I would want to invite Susan to take us through the next half before we can hand back to Nicola. Questions are welcome.
Thank you, David. I hope we can all hear me. This is Susan Alamai, the Senior Probation Officer at Tororo, and mine is basically to give you the perspective from government. As a local government, the challenges we faced are not very far from what David has already shared. And one, there was a challenge of restricted movement within the district to only essential staff. Remember, you may think you are essential, but government had its parameters of defining who was essential, and this did not include the paraprofessionals, the parasocial workers at the community level. It was a hassle. You struggle in the small car and maybe give permission to ask the paraprofessional to meet you at a certain point the next day that you'd be in the community. The other challenge we had was about the sources of income, which were greatly impacted by the restrictions on movement, which led to high dependency on the supplementary emergency funding that had to naturally come from partners. And we also had a challenge of following up visits to the reintegrated children. These were reduced. If you are visiting 2 children on day X, you had to make sure that your visit lasts for a period of time that would also enable you to come back home before the curfew sets in. The number of visits also had to be reduced. Maybe instead of 4, you end up with 2, so that you can visit more children. There was also increasing number of individuals requiring psychosocial support. The challenge of what the future holds, the difficulty of managing children at home. People are used to having children for fewer hours at home. And then we also had a limitation on our side as the technical persons in hosting physical meetings. For instance, the case conferences in communities, maybe would have been able to reduce on the numbers of children getting into teenage pregnancies, among others. So case conferences were difficult to hold at community level, and as well in the district level, it was a challenge holding the child well-being committee meetings to discuss and resolve matters of children and the associated domestic violence that came in from families. How did we manage? Movement permits had now to be decentralized. The resident district commissioner was the one giving us movement permits at the district level. There are teams that could get them from the Ministry of Works at the national level, but down here it was decentralized to the RDC. Of course, this permit was given to the vehicle that was procured by a partner. Thank you, SIF, for making it possible for us to move at that time. We also had the benefit of emergency support funds, which were provided by partners to supplement government funding. Most of these were funds that were reprogrammed from the activities that should have run normally, but due to the lockdown, they had to reprogram them to manage the issues that came up with the unanticipated issues that came with the lockdown. We also carried out remote psychosocial support on phone for those who were able to have phones and be able to call the national helpline and then get back to us, and also those who are reaching our paraprofessionals. This also was funded by the supplementary funding from partners like Child's Eye Foundation, UNICEF, among others. We also had to heavily rely on referral of cases to partners and other relevant but accessible departments. Remember, David said in his presentation, we had issues of malnutrition, but also we had challenges of people whose adherence was in question because they could not come and pick their antiretroviral drugs. And then also the supplementary feeding that is recommended by the Ministry of Health. Basically, that is what we had. I want to thank you.
Thank you so much, Susan and David. We really appreciate these reflections. David, I think you very clearly demonstrated both the negative impact and the positive impacts of the COVID-19 crisis. On the one hand, very sobering statistics on the impact on violence against children, particularly in the home, amongst other things. And I think it was particularly striking the way you were saying that the crisis in particular tested systems at community level and how critical really the social service workforce was at both the micro and macro level, and particularly the role of community volunteers. And Susan, thank you so much for the reflection on how government service provision was affected by COVID-19. There were so many key points, but one of them being that the big challenge was that paraprofessionals were not considered essential staff. Everything that came with the challenge of restricted movement. And then on the other hand, very innovative approaches in addressing different issues, such as the provision of remote psychosocial support. So if you have any questions for David and Susan, we really encourage you to leave questions in the chat box, because we're going to really ensure that we have a sufficient time in the end for discussion. We're aware that we're moving a little bit behind schedule, but we wanted to really take advantage of having this very, very rich overview. So with thanks to David and Susan, I'll now turn over to the next speaker, which is Ken Ondoro. He is a researcher with Child Frontiers, and we're now turning from the COVID-19 crisis to the climate crisis. And Ken will briefly outline the findings of the case study that I mentioned at the beginning of the webinar. This is a case study on the impacts of prolonged drought on care in Kenya. Just to note that this case study was developed in 2023 as part of the learning platform. So over to you, Ken. Thank you.
Thank you. Thank you so much. So I'll move straight to the presentation. Thank you, the team from Uganda, for that exciting presentation. Yeah, so this is a study on a case study that we did in Kajiado County. And just to give you a little background, that Kajiado County is about 108 kilometers from the capital, Nairobi. About 1.5 hours drive to Kajiado, predominantly occupied by the Maasai. And the main economic activities in this context are livestock rearing and crop farming. This was particularly a very small-scale study. The sample was too small, I think, to make firm conclusions, but nevertheless, it gives us some highlight of how climate change is impacting on children's care, and raises valuable questions that could provide a foundation for further research. There are actually drought. So according to the people we interviewed, the area suffered 5 consecutive periods of failed rainfall. And these people being predominantly lepers and farmers, almost all of them ended up losing the livestock, as we'll see in the next slide. Next slide, please. Yeah, so as I've mentioned, that this area suffered one of the greatest impact of drought in Kenya. There were loss of livestock, there were loss of crops. They couldn't do any farming, and this mainly meant that they lost their source of livelihood. In fact, most of them talked about everyone in the community being equalized. in the sense that in the previous periods of drought, you'd find that people would lose a certain number of livestock, but they would remain with a certain number of livestock. But in this period, almost everyone lost their livestock, and that impacted on them in terms of poverty and hunger. So they were talking about high levels of poverty, no food, stress, and violence at home, mainly as a result of lack of food and men being stressed due to the loss of livestock. Access to education was impacted, and it was mainly in two fronts. One, that children did not have, did not see it important to go to school because there was no food. And number two, parents lacked some money that were needed in school to take their children to school. In fact, some of the schools we visited where there were school feeding programs, there were a high number of children in those schools and schools that did not have school feeding programs. The other thing that they talked about is loss of family and community support systems, and they were talking about
Então,
having a role
outra
of
perda
social support systems that used to
da
have,
rede de apoio.
related to the issue of equalization that I talked about, that the drought equalized everyone. So even though, according to the Maasai culture, initially during the drought, everyone did not lose the livestock, and those who were left with at least higher number of livestock would then support those who had either lost all the livestock or lost a considerable number of livestock. And with this, next slide, please. And with this, we saw the rising separation of mainly girls and boys due to work or marriage. So girls were becoming domestic workers. Most of them went to Kajiado town or proceeded to Nairobi town where they were employed as domestic workers. Boys were leaving home to herd cattle. Some went to the street to beg. And what we also found out is that the traditional arranged marriages were on the decline because of the lack of bride price, which was mainly the livestock. However, informal unions, mostly referred to as in Kenya as kamistay, were on the increase. And this was mainly because girls felt that girls were running away from the hardships at home. And there was this general feeling that marriage would then would help to solve the problems that they were facing at home. And there were mixed impacts, mixed evidence on the impacts of drought and kinship care. So some reported that the kinship care was failing because extended families could no longer support their children. And I think most of the people reported this. Others said that it was continuing, but only if there were family members living in the urban areas and they had some resources to support the children that came in to live with them. As I've mentioned earlier, that the drought had a big impact on livelihood. And the livelihood there is also the source of income for most of the community members, and this affected their earnings, and in return, inability to pay boarding school costs for their children. And therefore, these children were withdrawn from boarding schools, and some were either sent to relatives to attend the close day schools that were close to the relatives, or some ended up completely dropping out of school. What we also observed, next slide please, was increased demand for residential care and the changing nature of this care. When we interviewed most of the staff of the residential care, they said that many desperate parents wanted their children to be admitted in residential care. And so they would literally walk to these institutions and request for their children to be admitted. However, because of the care reform process and the strict admission process, most of these children did not get admitted to these institutions. However, we also observed that most of the children who are going into these institutions were being rescued from marriage most of the time. So we could say that most of the children during this period that were in these institutions were rescued from either marriage or from work. And so that shows us the kind of children that were in the residential institution. What we maybe did not find out is what happened to these children who their parents requested to be admitted into the residential care, but did not get placements in these institutions. Thank you. Next slide. So in terms of reintegration, we also saw that climate change or climate-related event, especially drought, had an impact on reintegration. And most of the people we talked with were saying that most of the gains that had been achieved, especially from the COVID period, were being eroded by the drought. For example, most of the parents, so there were descriptions of most of the parents literally running away from children who are being reintegrated back to their homes because they felt that they did not have the resources to support these children. And so the reintegration process became a big challenge. Secondly, most of the staff from this residential care told us that sometimes they were caught between a rock and a hard place, reintegrating children into homes that were suffering from extreme impact of climate change. There is lack of food, lack of shelter, and they could observe that the parents could not take care of these children. And we also, learned from these interviews that communicating these challenges to the government also was not easy, because the government felt that drought was being used as an excuse to slow down the reintegration process. Next slide. So we also learned that children experience multiple forms of separation. So, for example, children going to work, there was an escalation in terms of pregnancy, and it was mostly as a result of transactional sex. Most importantly, we learned that there were two things that were fueling transactional sex. One was lack of food, the other one was lack of sanitary towels. And the other separation was in form of child marriage. Like I've mentioned, that the traditional arranged marriages were on the decline, while the informal unions were on the incline. I've talked about children leaving to work, children being removed from the street, or marriages to enter residential care. And I've talked about lack of proper support for integration from residential care to the community. Next slide, please. So we are seeing that drought is affecting the quality of children's care. And we are seeing that families are able to supervise their children due to women entering paid work. So women spend less time with their children. We know that in this context, men usually migrate at the onset of drought in search of greener pastures and water, and so they're never at home. Children spend more time at home, children being out of school, either due to school-related levies or children being sent to work. We're also seeing that caregivers were being stressed and
Oh, I think we've lost Ken. So, Nicola, maybe I can just wrap up on the last couple of things. I think we've possibly only just got, one more slide to go. So I'll just wrap up on that. So as Ken mentioned, we've seen this decline in the quality of care, with parents less able to supervise children, but also communities less likely to supervise children. So whereas previously support to children and supervision was seen as the responsibility of the whole community, because everybody's struggling so much, they no longer have the time or the kind of energy to supervise children in the way that they used to. And we're also seeing some care homes really struggling to provide adequate food or water due to a fall in community donations and also lots of rising costs or linked to the loss of livelihoods as a result of the droughts. So that's kind of really reflects something that David was saying also in his presentation on COVID. So just wrapping up on some of the implications of these findings, obviously a really small scale study, but I think it demonstrates the importance of recognising and responding to climate change as a major feature of all care reform programmes in the region. We really need to be thinking about this because it's clearly having a big impact. It's placing huge pressure on families, and I think this creates an even greater impetus for reallocating resources away from very expensive residential care and into families so that they can provide for children. We also can see that the linkages between climate change and children's care are quite complicated, and they may often be pulling in multiple directions at the same time. So, for example, we're seeing in some cases children, some types of child marriage reducing, some types of child marriage increasing, and that obviously has an effect on children's separation. Similarly, children being sent away to boarding school or not sent away to boarding school or into kinship care, sort of pulling in lots of different directions. So we clearly need some further research on this to really understand what's going on and how this might vary by different settings and different types of climate change related emergencies. And the support that children in residential care and their families receive may need to be adjusted to reflect the growing numbers of children entering these facilities because of marriage or work or violence in the home. So whereas previously children were entering this care because of a lack of access to education or poverty, now they're coming in for different reasons, and that means that they have different support needs. So climate change having a huge impact on poverty and emotional well-being. We had lots of participants talking about men in particular really struggling with their emotional well-being because of the loss of their livelihoods, suggesting that social protection and mental health must increasingly be a feature in care reforms. Okay. Sorry, I see we've got Ken back now. Sorry, Ken. I just stepped in so Ken can answer any additional questions that you have at the end. Back over to you, Nicola, just to introduce the next segment.
Thanks, Emily. Yes, and glad to have you back, Ken. And once again, thanks to the Child Frontiers colleagues, especially Ken, for that really clear overview. And in the interest of time, I'll hand it over actually back to Emily for the discussion now, because we really want to make sure that there's sufficient time. Emily will discuss with the colleagues from UNICEF Ethiopia on the final piece of the poly crisis that we're discussing today, specifically how conflict affects children's care. So over to you, Emily.
Thank you. So we're really delighted that Deus has been able to join us from UNICEF's office in the Tigray region in Ethiopia to tell us a bit about the impacts of the conflict on that region on children's care. So perhaps you could just start off by letting us know, for people who aren't familiar with what's been happening in that part of Ethiopia, a bit more about the background to the conflict. Yeah, go ahead.
Thank you so much, Emile, for the opportunity to appear on this panel for a discussion on childcare in the conflict. And just to start, the conflict in Ethiopia region, which is far north of Ethiopia, fighting again.
I'm sorry, Des, we're losing you a little bit. I'm wondering if maybe if we turn off your video, if that might help. So, oh, I'm so sorry. I hope maybe it's just me, but I can't hear what you're saying at the moment. There's a distortion on the line.
Yes, same here, Emily.
Okay. Des, can you I don't think you can hear us either now.
I'll try over the chat.
Yeah, thank you. Des, maybe you could just can you hear me okay? Oh dear, how frustrating. I was really looking. Hi Des, can you hear us okay? I think we might have lost him altogether now. Oh dear.
It worked so well when we did the test.
I know.
So,
well, hopefully he'll come back. Maybe I'll just switch, because I was just going to do a little wrap-up presentation at the end. So maybe I'll just go into that, and then we can, if he comes back online, then we can come back to him. Okay. Okay, so just wanted to really summarise from the presentations that we've had, and also from some of the research that we've carried out as part of the learning platform. So we have done a paper on lessons learned from COVID, which is really looking not just backwards at COVID, but forward about what lessons that we've learned from that period that we can take forward in our care reforms. And we've also done a paper and case studies on the links between climate change and children's care in the Eastern and Southern Africa region. And we've done several webinars and kind of discussions around care and humanitarian contexts more broadly, including contexts affected by conflict. So I think the kind of key message coming out of all of these pieces of research is we really need to have the poly crisis at the forefront of our thinking and our planning around care reform. We can see that COVID is thankfully no longer having this horrendous impact on our lives that it had for a couple of years. Sorry, Nicola, did you want to say, sorry? Is that okay? Okay, I'll carry on. But it's still led to kind of a lasting legacy, which I think David illustrated really beautifully in his presentation, and Susan as well, about how we care for children, on the kind of resilience and capacities of families, and children's schooling, all of which has obviously a huge impact on children's care. And I think we can see from COVID also that the legacy isn't entirely negative, and it led to lots of kind of positive implications as well in terms of learning new ways of doing things. And climate change is, as demonstrated by Ken's presentation, I think really very present in the region. And in addition to drought, we're also going to be much more exposed to heat waves, cyclones are going to increase in intensity and severity, and conflict is also going to be rising. So there's already beliefs that many of the conflicts in the region have been exacerbated by the limited resources and people fighting over those resources as a consequence of climate change. So I think all of this is showing this much greater need for care reform and a need for us to really invest in care reforms. As demonstrated by both presentations, we're seeing issues around the quality of care in families, both during COVID and during the droughts in Kenya, parents just being exhausted and finding it hard to devote sufficient attention and energy to caring for children. And violence in the home also increasing due to the high levels of stress that people are exposed to. And we are seeing already that both during COVID and climate change and conflict, that this leads to all of the key drivers of children's separation, so poverty, violence, lack of access to education, increasing, and we're already seeing increases in the numbers of separated children. So, for example, the conflict in Ethiopia, which we hope we'll get onto, has seen at least 9,000 children separated from their children as a result of that conflict. As Ken showed very beautifully in his presentation, children are experiencing these multiple separations. So they're not just being separated once, they may be separated from parents, enter into kinship care, that relationship break down because those carers aren't being supported, and they may enter work or go from work into marriage. So the support needs for those children are therefore quite complicated as well, and we need to recognise the pathways that those children have been through. And children within alternative care are also becoming increasingly vulnerable. So we've seen, as demonstrated in the presentations on COVID and climate change, that care homes really struggling to get sufficient resources to look after children. Kinship carers, especially the elderly grandparent carers, that are the most common carers, are becoming more vulnerable and therefore may also be struggling further to look after children. So we really need to be stepping up support to those groups. And of course, we're seeing that as governments are increasingly grappling with one climate change related emergency after another, they're really struggling to provide services and support to children and families, and often child protection services are the first ones that kind of get cut. So we're seeing really those services already being quite overstretched and really struggling to meet needs in the region when emergencies hit. So in terms of how we need to change care reform processes to respond to this polycrisis, I think we need much more evidence. We need to recognise that this is a dynamic situation that's constantly changing, and we need to be surveying what's happening and responding to those changes. As I've said already, climate change and the polycrisis really needs to be a backdrop to all care reform policies and strategies. And those strategies need to be flexible so that they can respond to the changing situation. So having perhaps a 10-year strategy with no clauses within it that you can change within that period is perhaps not appropriate at this time of kind of really rapid change. We saw during COVID that when crisis hits, communities, the role of communities really steps up and becomes even more significant, including the role of the community volunteers. So really recognising and strengthening this role is very important. We also need to prepare children for their future in a world badly affected by climate change. So we need children who are more resilient, who know about climate change, who have a strong sense of responsibility, collective responsibility to their communities, who are flexible, who are able to adapt to change. And all of the caregivers of children need to be supporting that. So whether they're in parental care, whether they're in kinship care, whether they're in foster care or residential care, those caregivers need to be kind of building up these capacities that children are going to need to survive in the future. And this is something that we should be thinking about in our parenting programs. We need to ensure that the workforce is ready. So as mentioned in the presentation from Uganda, that they're recognised as key workers, that they know about climate change, what's happening, how they can support their communities. As part of that, having a really solid understanding of emergency preparedness and response, and also the freedom to adjust to rapidly changing contexts in their communities, and just having things like the cars and the vehicles that can get around during floods, or offices that can deal with heat waves. All of that needs to be thought through. We know that climate change is seeing, and COVID and conflict, seeing increasing importance of social protection, education and mental health. And we really need to coordinate with those sectors, and make sure that we're all working together, because the problems are becoming more entrenched as a result of climate change, and require kind of coordinated efforts. And we really need to work with those experts. I can see we have a few of them on the call, but we need to be working much more with colleagues who have expertise in things like climate change, pandemics and conflict. So, for example, we need to really try and ensure that the climate change preparedness and response strategies are not just thinking about the kind of dealing with clean water supply, but also thinking about how children can be protected in those contexts. We need to look for and build on the many positive innovations that come out of rapid change. And we really need to avoid creating parallel systems. So we see this often in an emergency, where the emergency response will set up a foster care programme or kinship care supports that are not reflected in the national care reform strategies. So we need to make sure that learning from emergencies is reflected in national programming, and that that responses to emergencies respects national care reform policies and strategies. Okay. Thank you. Sorry, I wasn't able to look at my screen at the same time, but I'm not sure if we have got Deus back yet. I think perhaps not.
No, I don't see him.
Okay. Okay. So
Oh, actually, sorry. I'm so sorry, Emily. I think he just may have joined.
Oh, brilliant.
If you, depending on how your screen is coming up,
Yeah.
be towards the end.
Yeah. Deus, are you with us again?
Yes, I'm with you.
Oh, wonderful. Oh, good. So sorry, we didn't really hear anything of what you had to say. So maybe you can start again and tell us a little bit about the conflict in the Tigray region in Ethiopia.
I'm really sorry about the
No
internet
problem.
connection that I was not. Yeah, so the conflict in Ethiopia, I think many people have heard about it in Tigray, and you have also heard about the good news of the peace agreement that happened in November 2022, where the government of Ethiopia, the federal government, was able to sign a peace agreement, and then it ended the conflict that had spanned for 2 years. And then one of the things that this conflict did was that it affected the neighboring regions, mainly Afar and Amhara, where most of the displacements happened, and people were moving from one region to another, and also within the region. And most of the people that were displaced during the time of the conflict included the children, and 2 million IDPs, of whom over 50% were children. And it happened at a time when COVID-19 was also a big disruption to the social setup of the population in the country. And amidst all of that, there were also climate change induced weather shocks, which were characterized by long spells of drought, which also occurred since 2020 and are currently going on. So drought has really kind of succeeded the tensions that were brought by the conflict. And this affected livelihoods, the social welfare, and the care of the children in Tigray and the neighboring regions, and actually in most parts of Ethiopia at the moment. So this is how the conflict really happened. The poly crisis, bringing together the three main shocks: the climate change and the conflict itself, and then COVID-19.
Thank you. That's a great illustration of what we mean by a polycrisis. Thank you for that. Please go on, yeah.
As to how the conflict affected the children, how it impacted on the children, Emily, if you can allow, I can proceed.
Yes, please go on. Yeah, we'd love to hear about how it impacted, particularly on children's care.
A huge number of displacements, and specifically children, because at the height of the conflict, we had about 15,986 unaccompanied and separated children. And these were mainly in Tigray region, and also in the neighboring regions they also had. But the good news is that we had a number of partners who participated in strengthening the programming around unaccompanied and separated children, and we were able by now to have reintegrated over 10,000 children and placed another big number of children into alternative care, mainly extended families and kinship, and foster care families. So currently we have like a caseload of 5,400 children that are not yet placed into their families because of different challenges, whereby their families have been moving here and there, and their families have not been traced because of different reasons. But of course, family tracing and reunification has been ongoing. But during the conflict, it was really very hard to do family tracing and reunification. We were only able to trace families, especially during the latter part of the conflict, where movements were allowed and people were able to access transport means, especially our humanitarian workers, to move to different locations to trace the families. And when telephones were restored, because during the time of the conflict, all the telephones, the internet had been shut down, and our workers could not be able to really access any means of communication to reach the families. And then there was really a complete breakdown of family structures and the social networks. We used to have community coalitions at community level. We used to have child protection committees. We used to have community-based child protection mechanisms. All these had been disrupted by the war. And of course, the alternative care system in Ethiopia is also still quite young and nascent in terms of the operational framework. So we were counting on the strong bonds that they have, especially around kinship care, and we could find that it was possible for relatives to be able to take on children and be able to care for them. One other impact that we saw during the conflict is akin to what my colleague from Kenya just mentioned, and also colleagues from Uganda. mental health and psychosocial distress was so high during the conflict. Even after the conflict, due to the shocks posed by the drought, we noticed we have handled the cases where some children attempted to commit suicide, especially in the IDP camps. And this was because of the long periods of separation from their parents, and also due to the horrific situations and traumatic incidents they were recalling, the horrible incidents they saw during the conflict, looking at how the people they knew, the close relatives were dying, and then they also suffering not having food during the aftermath of the conflict. And then some of those children decided to commit suicide, but we were able to keep monitoring them closely with our partners to see that they were helped by providing mental health and psychosocial support. And also, one serious disruption was the closure of education institutions. This began with the COVID-19 lockdowns, and then it went into, when the country went into the conflict, all schools were closed. And not only that, most of them were bombarded because of the crossfire. And in total, we realized that the children in Tigray actually lost 3 years of education posed by the conflict and posed by the COVID-19 lockdowns. And this resulted into many of the children actually going into the streets. Most of the children, especially girls, were victims of child marriages. We also had incidents of children who were involved in child labor and also trafficking. And then also had, we didn't have access actually in most of the locations. During the conflict, we didn't have access to provide humanitarian support to some regions, to some locations. Partners could not move, and some of those badly needed services that children required could not be provided. One reason was, as I earlier mentioned, transport was disrupted. There was no food, there was no public transportation in terms of air and road transport, and cash was limited. Actually, we used to carry cash from Addis Ababa via UNHAS flight because banks were closed. So even if the partners wanted to buy items to provide to families, especially to support reintegration and also to support foster parents, it was not possible because the funding was so limited. So we were mainly working on a few basic things. And this escalated sexual and gender-based violence. We have received reports of many families that were affected, women and girls, due to rapes that happened. And now we have a lot of children that have been born out of rape. And this is quite a very challenging issue to handle at the moment. And we are trying to work with the different stakeholders to see how they can provide mental health and psychosocial support, but also to see how an aspect of reconciliation and peace can also be factored into the work that we are doing. And we also have noticed that because of the conflict, there are so many remnants of war, that is including unexploded ordnances in various locations, which have now led to a lot of injuries and sometimes death to children and their families. And it came at a time when we didn't have UNHAS within the region to support in terms of demining, and even the equipment for demining are not yet currently available. So UNICEF took it upon itself to mainly work on the awareness raising aspect and also victims assistance. But of course, the aspect of demining has not been well managed and well facilitated. So this has been a very, very big challenge.
Yeah.
So many cases of
Thank you, Dose.
injuries.
That
And then, thank you so much.
Thank you. That was so helpful and interesting. I was particularly interested in hearing about this kind of the accumulation of the different crises and the impact that that had on families and children, for example, leading to lengthening gaps on education and therefore that having an impact on marriage and girls' pregnancy and those other areas that you mentioned. I was also really interested to hear about how when things got particularly bad, it was very hard to provide any other form of residential care other form of alternative care other than sort of focusing on supporting kinship carers to look after children, again highlighting the kind of importance of that form of care in the region. I'm just going to pause now because we've only got 5 minutes left, and I just want to see if anybody has any questions, either for Dose or for any of the other speakers. I don't think anybody's listed anything in the chat, but if you would like to raise your hand or would like to just write a question in the chat, please go ahead and do so. Otherwise, I'll hand back over to Nicola to kind of wrap up the webinar. Okay. Can't see any hands or any questions, so I'll hand back over to you, Nicola, just to wrap up now. Thank you.
Thanks so much, Emily, and thanks for all of the participants that are with us today. We can tell that you've really stayed to the end, so really appreciate your interest and the exchange. And I think, you know, what the presentations all really made very clear is that we have to have the polycrisis at the forefront of care reform. Climate change is really present in the region, and what we see is that child protection doesn't really feature appropriately and adequately in the response. And we also see, of course, in the region that conflict is rising, and that you know, the limited resources resulting from the climate crisis, of course, are leading to an increase in conflict. And at the moment, together with colleagues, I'm attending a regional meeting between IOM Save the Children and UNICEF on children on the move. So this polycrisis and the care of children on the move has also very much featured in that discussion, which is very important. Maybe just to highlight a few more elements that really came up in the different reflections was that we really see that the drivers of separation are increasing. And there was a very important point made by several speakers in terms of the impact of on mental health and the consequent increase in the need for mental health and psychosocial support. And finally, you know, one key point raised was that we really need more evidence also on the impact of the polycrisis. And there's a very interesting piece that my colleague Jan is leading at the regional level of UNICEF on the climate crisis, which I think we will be in the future be able to really benefit from. So we're right on time, and once again would really like to thank you for your participation. We have a short poll that we would greatly appreciate you completing. And just to note that our next webinar will be in May, and that we will specifically be looking at the evidence base for care reform. So we'll keep you posted on the exact date in May. You'll be hearing from us, particularly via the mailing list that I hope you've all by now signed up for, that we had talked about, especially at the beginning of the webinar. So with that, I wish you a very pleasant afternoon and evening, depending on your location. And we look forward to seeing you in the next webinar in May. Thank you.
Thank you, everyone. I'm just going to, just in case a few more people want to complete the poll, I'll just leave it up there for another second or two. Thank you.
Wonderful.